All right, my name is Chris Bass, student nurse at MCC. Today we're going to be giving medications through IV push and IV piggyback. We're going to check our orders to the MAR. We're going to check for the right patient, right route, right dose, right time, and right amount. Then we're going to check the patient's allergies, make sure that they are not allergic to any medication that we're going to give. And then we're going to compare the drugs to the MAR. Today we're going to be giving Lasix and Claflin. Patient's supposed to be given 65 milligrams of Lasix and 1 gram of Claflin over 30 minutes. So the next thing that we're going to do after we've checked the patient for allergies, we're going to go ahead and get check our medications, make sure that they're all compatible and everything with the solutions and dilutions that we're giving. So we're going to check Lasix first, or actually we'll check the Claflin first. It's diluted. It's a safe dose. It's given 1 gram, 2 grams over 24 hours. He's getting 1 gram over every 12 hours. We're going to check the dilution, make sure it's okay to be given with the medications that the solution we already have hanging. And it's supposed to be mixed in D5 or normal saline, and it looks like it's mixed in D5, so we're good there. We're going to check and make sure the rate of administration is over 30 minutes. So with the previously done math, there's going to be 33 drops a minute. Is what it'll equal up over the 30 minutes. You're going to give the whole 100 milliliter bag. We want to check, make sure they're not hypersensitive to any of the medications, and we're going to make sure we monitor the CBC and make sure the treatment is effective. The next thing we're going to do is check our Lasix, make sure that it's furosemide, make sure it's compatible with everything that we're given. Alright. Furosemide is given 20 to 40 milligrams, maybe replaced every 2 hours. Acute pulmonary edema is given 80 milligrams. So we're going to be in our range. Dilution is going to be, it's given undiluted, so we don't have to worry about that. I need to make sure it's compatible with our solution, which it is. It's got D5 hanging, and it's compatible with D5W. Rate of administration is going to be given 40 milligrams with a fraction thereof over 1 to 2 minutes. So we're going to be given 65 milligrams, so we're going to be giving it over 2 to 4 minutes. Now that we've compared all that, we're still at the nurse's station and we're going to get our drugs together. Make sure get everything done ahead of time. That way, when we get in there, we're good to go. Before we do it, we're going to make sure we have good hand hygiene. So once again, we're going to check sure we already checked the rate. The diluting and rate and all that. So we're going to go ahead and pull up our drugs and label our drugs. We're going to be given 65 milligrams of Lasix, and the Lasix provided is 100 milligrams and 10 milligrams, which equals a simple concentration of 10 milligrams a milliliter. So we're going to draw up 6.5 milliliters. We're going to clean our top. Get our syringe and the needle that we need. Go ahead and pull back to 6.5. 6.5. We're going to remove our needle. Insert into the bottle, making sure our needle stays in the bevel. Insert the air, and we're going to get back to 6.5 milliliters, which is 65 milligrams. And we're going to make sure all the air is out, and then we're going to turn this back over. We're going to recap the needle. And we're going to leave it like that, and we're going to label our medication. soon as I find where that label went. There it is. Patient's Mr. Smith. Drugs is Lasix or furosemide. Amount is 65 milligrams or 6.5 milliliters. Prepared on 9/13 at 1904, and prepared by Chris Bass. And we're going to make sure we label it. All right. Now let's go ahead and make sure our clafrin's together. We already made sure it was compatible with the D5. It's already coming pre-mixed. It's 1 gram and 100 milliliters. So we've got that done. We're going to go ahead and label it. I gotta look to see how to spell clafrin. CLAFORAN. CLAFORAN. Amounts 1 gram. Added by the pharmacy. Date 9/13. 1906, and we'll add the start time and everything when we get there. All right, now we got our drugs together. What we'll do is we'll go to the patient's room and go ahead and administer our medications. So we're going to come into the room. Hey, how you doing, sir? First thing we're going to do is verify the patient and by 2 identifiers. We're going to check his armband. Sir, what's your name? What's your date of birth? And we're going to ask him if he has any allergies. His allergies are clear. He doesn't have any allergies. So then we're going to explain to him what we're going to be doing. We're going to be giving him, Mr. Smith, we're going to be giving you your medications today. We're going to be giving you some Lasix for the edema that you have on your lower extremities, and we're going to give you for the antibiotic that you have for your UTI. The next thing we'll do is go ahead and make sure that our IV line is patent. We can do that by a few ways. Number one, we check and make sure there's no redness, tenderness, or swelling. We can open the bag up and make sure that there's blood returned in the bag by lowering it below the IV line. But seeing that it was already running, we know that it's a patent line. So we're going to give our IV push medication first. We're going to give him his Lasix. It's given over 2 to 4 minutes. So what we'll do is we'll get another alcohol prep and we'll clean the site closest to the patient. Is where we're going to insert the Lasix. Clean the site. Remove the needle and put it in the sharps container. Make sure there's no air in the line and the syringe. And then we're going to pinch off between the bag and the port. Okay. Actually, we'll attach this first. And then we'll pinch off above the port. Now we're going to give this over 2 to 4 minutes. And we're going to start now. And after every little push, we're going to let a little bit of fluid go through. A little more. And let the fluid go through. A little more. And let the fluid go through. We're going to push a little more. Make sure clamping off every time. And let the fluid go through. I'm going to pinch it off. And let the fluid go through. Pushing the fluid, the medication in it, and then letting it go through. Push a little more. So, Mr. Smith, how you doing today? Good to hear. Good to hear. A little more. And just a little more. All right. After we get done with the medication, we're going to dispose of it in a sharps container. And then we're going to check the site for any redness, swelling, irritation, pain, anything like that. No pain, no redness, no swelling, and no irritation. The next thing that we're going to go to is we're going to hang our IV piggyback. We're going to go ahead and get our IV drop set, our secondary drop set. Get it out. Make sure that it's always maintaining sterility and aseptic technique. Roller clamp closed. We're going to lower our primary infusion bag. And once again, while we're doing this, we're going to ask Mr. Smith if he has any allergies or if he's allergic to anything. And we're going to bleed our line. We're going to fill our chamber. And we're going to bleed our line. Making sure there's no air in the line. We're going to make sure that that's closed off, rolling the roller off completely. We're going to cut our primary line off. Getting the alcohol swab. We're going to use the port closest to the IV bag. We're going to clean it. We're going to attach our secondary line. Secondary line attached. We're going to open the roller on the secondary piggyback line. We're going to control our drop rate through our primary line, and what we're going to be running at is 33 drops a minute. right, we're at 33 drops a minute. Now that the medication is infusing at 33 drops a minute, we're going to check for any redness, swelling, irritation. There seems to be none, so what we're going to do is while this is running, we're going to document in our MAR whether it's PRN or stat medication. Make sure we state what medication we're given, the dose, the rate, the route, the amount of time, the time it was given, what time it was started, and this one was started at 19:15, which means it's going to need to be done by 19:45. 30 minutes go by, IV infusion is done, piggyback infusion is done. Since it's done, we're going to we're going to cut off our primary, roll off our secondary infusion, disconnect it, dispose of the secondary infusion in the appropriate container, and rehang our primary infusion and set it back to the rate at which it was going. And that concludes IV piggyback and IV push.